Greetings. I'll be presenting this presentation with the title, An Ambulance Service Evaluation of Quality Control Measures Based on Patients' Perception in Qatar. I'm Reno Carolus, and on behalf of my co-authors, Kanaya Kumar Singh, Jalal Yunus Albert, and Guillaume Alané. So before we start, just a disclosure, myself and the other authors, we acknowledge that we do not have any financial interest or commercial interest or any connections with any institution or persons for such matters. So as a background to our presentation for today, healthcare quality management is a well-known concept within this context, but a lack thereof poses significant legal, financial, as well as various risks to the employees, patients, and the institute itself. So having a system of improvement in place is good, but we are of the premise that having a proactive system improvement in place is required. In other words, we are proactive at looking and reviewing the system that is in place and not just having a system in place. So it is not clear if current quality control measures are perceived by the patients. So in essence, it's not clear whether the background work of quality control, which forms part of quality system, does it transpire, does it translate down to the patient's level, where the patient actually have a perception of those background work. So the study aims then to understand, is there any correlation in quality control and what the patients perceive within the context of the pre-hospital setting. More particularly, Hamad Medical Corporation ambulance service in Qatar. So the methods that we have used, we've utilized a survey that we've distributed to 255 patients meeting our inclusion criteria that we have transported to Hamad General Hospital's See and Treat unit. So the low acuity cases in essence. Our model is based on the SERVQUAL model, standing for Service Quality Model, and it has 5 dimensions: reliability, assurance, tangibility, empathy, and responsiveness. Now we have added a 6th dimension, quality control, and this is what we are so interested in. And just to illustrate, we have the 5 dimensions that we are going to see if there's any relation to quality control. And we have utilized the Spearman's rank correlation to help us understand this. Our survey consisted of Likert scale, and it was 1 that is strongly disagree and 5 strongly agree. The results that we have found was as follows. The mean age was 33.46 years, and most of the dimensions correlated strongly with quality control, except for assurance that had a weak correlation and tangibility a moderate correlation. So there can be various reasons for this. However, our interest is to see if there was any correlation, if at all present. Now, part of quality management is putting the customer first. This is one of those principles. And in our case, putting the patient first and having a patient focus. So that's why we've went down to the patient's level, frontline, and ascertaining what our patients really perceive from the efforts of quality management and the quality control processes that is in place. Now, we found that the variables that's driving the results from these dimensions, these are providing services within promised timeframes, access to care, and the patient's perception of ambulance staff's willingness to help. And these were the key ones that we have highlighted as significant from the study. Now, there could be various other reasons for the weak and the moderate correlation, but it can also mean that these areas that need improvement. Now, without really having this type of information, we don't have that area to move forward. It's like we're just in this void. So we've really come down to the patient's level. So we have a social obligation to be responsive and active in the prevention of risks or problems in the interest and welfare of our patients and the community. What we do needs to benefit our patients by fulfilling our obligations. So even if it means that we need to break down processes, analyze them, look at systems, problem solve, re-engineer wherever it's required, and maintain reflective practices, then that is what we need to do to move forward, to stay true to corporate social responsibility. So we've shed light on the importance of evaluating quality processes and limiting internal costs that's associated. So the ambulance service quality control measures appears to be favorable from a patient's perception point of view, from the services that they receive. From this point on, there's still much work to do. There's much areas to investigate, but every little bit helps to move our service forward. With that, I thank you.